More on this, let's speak to Bilal Irfan, who is a bioethicist and researcher. He joins us live now. Welcome to TRT World. Your reaction, Bilal, to these findings, and what have we learned?
Yeah, thank you for having me, Maria. I think as kind of you pointed out in the summary of the study's findings, I think the biggest thing that we can see is that the level of aid that has been allowed and permitted to enter the Gaza Strip has itself been related to the malnutrition and the nutritional status that we're seeing in patients. And obviously, this study looked specifically at children that were aged 6 months old to just about less than 6 years old. So we're talking about really, really young children that are in such high numbers experiencing acute malnutrition. So it's obviously really concerning. And what we also see, for example, is some of the spikes, right? We saw something as high as 32% of children in Rafah that were experiencing acute malnutrition. So it's really concerning, but what we do know, based on at least, especially that snapshot that we have of the ceasefire period, where the levels did decline of malnutrition that's being observed. So what we hope and what we do know is that if aid is allowed in, we can reverse at least some of the effects that we're seeing on the nutritional status of these children in Gaza.
Bilal, that's such an important point. If aid is allowed in, you can reverse the consequences, I imagine, of this wasting malnutrition in Gaza's children. How much aid would have to come in? How specialized would that aid be? Are the agencies even prepared at this point to work with wasting malnutrition?
Yeah, so this study was even conducted based on data from UNRWA itself, right? And we know that UNRWA and many of these other United Nations agencies, as well as other international aid agencies, they have been operating in Gaza quite successfully in food aid distribution. And then when we had this kind of change to the GHF system, which has been kind of part of the process of destroying the nutritional status of Gaza's population and destroying their ability to access food, right? When you're reducing dozens of aid sites into just 2, 3, or 4, people are not able to access nutritionist food. And a part of it is also, right, being able to get a high protein diet. I know I'm talking to people in Gaza right now that have been talking about hoping to be able to eat chicken or poultry or fresh fruits for the first time in months. So that's definitely a part of what's needed, right? You need a diversity in the diet that people are obtaining in Gaza. And based on kind of even ongoing studies right now in Gaza, preliminarily, what we can suggest is we see that malnutrition is not just affecting this young children age group, but it's also affecting adults. It's also affecting older adults. It's affecting male and female. And we can really think of this study's findings as being kind of complementary to the IPC famine reports that came out in August 2025, just about 2 months ago now.
And Bilal, what are the consequences, immediate and also long-term, of wasting malnutrition?
Yeah, so in the short term, it's definitely going to, similar to really any other underlying health issue, it's going to lead to a weakened immune system, which makes you more susceptible to other diseases. We know infection is prevalent in Gaza, so that's definitely a threat to these children, especially young children. But also in the long term, while we do hope that some of these changes are reversible, at least the levels that we see of acute malnutrition may decline. However, when they do manifest in such a young age, sometimes the consequences of this are not fully reversible in the long term, and these children may grow up to be more susceptible to certain chronic illnesses, and it can lead to poorer health outcomes. And there's quite a number of studies that we've seen based on other famines and in other parts of the world that have pointed to kind of the long-term negative health consequences from this. So even if we do reverse some of it in the short term, it's not fully irreversible when people are, especially en masse, going into starvation, is what we see in Gaza at the moment.
Bilal, thank you so much for speaking to us today on TRT World. Bilal Irfan, really appreciate it.